I'm Donna Booth. I'm an ACP with Tameside and Glossop Integrated Care NHS Foundation Trust, and I'm just going to talk to you a little bit about my internship experience. So, in terms of my background, I'm an ACP. I work across the 4 pillars of advanced practice, clinical research, education and training. I qualified in 2024 and I trained across GP and virtual ward. I had previously undertaken a research internship during the pandemic, but that was very limited because of lockdown rules. And also during my ACP training, I did undertake a research module involving designing and carrying out a local project, which spurred me on to apply for this. So I do wish to pursue a clinical academic career, and on successfully applying to the RGM research internship programme, I was allocated Dr. Faye Bradley as a supervisor because of her work on a local service evaluation of virtual wards. So to actually guide my outcomes, I conducted a skills analysis, which was based on the core activities within the research and development framework. So to develop knowledge, I did plan to undertake a non-assessed qualitative research module, working with a local research team to supplement. I wanted to develop academic skills and also plan to undertake courses, including literature searching and critical appraisal to facilitate this. And I also wanted to network with other professionals and to prepare myself for future study. So what are virtual wards? So they do intend to provide hospital level care to patients within the home environment, typically involving remote monitoring. They can be used to facilitate both admission avoidance and early hospital discharge. They're thought to improve patient experience, capacity in the healthcare service and reduce costs, but there are barriers to use, including technology use, cognitive issues, homelessness and impact on caregivers. So at the moment, virtual ward use is typically underused compared to capacity. So a mean of 65.65 beds were occupied during the 2024-25 year, compared with 90.82% of inpatient medical beds. So in terms of my area of interest, I wanted to focus on caregiver burden because of experience in clinical practice. So I initially conducted a literature review around the subject, intending to use this going forward as a basis for my own research. I carried out a literature search, and then that looked at both published evidence and it was later extended to grey literature. I appraised the evidence and analysed and presented it thematically, supporting both my academic and practical development. In terms of the findings, there were several themes that emerged: patient and carer experience, caregiver strain, technology use, and barriers and facilitators of uptake. There was an issue with lack of standardisation of services, which impacts generalisability, and limited evidence available around technology use. Findings typically suggested patients like virtual wards because of improved comfort and familiarity, but some did fear deteriorating at home. Caregivers reported less disruption to routine with reduced stress, but others had concerns around managing increased acuity. And key takeaways emphasise careful selection of patients and caregivers for virtual ward and improving communication and involvement of caregivers. And currently there is limited evidence available around caregiver strain, and that's something that I'm keen to explore in future study. So in terms of the internship outcomes, I achieved various things. So I improved my theoretical and practical knowledge. I also gained exposure to a local research project, although due to timing was unfortunately unable to directly participate. I built on my existing skills, supplemented by courses, and that also improved my confidence and ability. And I was also afforded the opportunity to network with both local researchers and those on a wider scale through attending the 2025 RCM Research Conference in Exeter. And participation in the internship has helped me to develop both personally and professionally, building on and expanding my skill set. I have developed personal confidence, being pushed out of my comfort zone, and I've also been afforded the opportunity to develop links which will be invaluable going forwards. My future plans are to build on my internship work and also to prepare prepare myself for future study, hopefully looking at applying for a pre-doctoral fellowship going forwards.